we have a lot of orals, but we see a greater use of insulin, earlier use of insulin. Where do you stand as far as, at what point would you put a person on either basal or basal bolus treatment?
So I think in type 2, well, obviously in type 1 diabetes, we use still mostly insulin, although SGLT2 inhibitors can be used in that disease. But if we're talking about the type 2 diabetes, I usually will begin using basal insulin if I cannot achieve fasting glucose level that I set as the goal for that patient. Because it's very hard to achieve good fasting level with any of the current oral medications. If you cannot do it, you really will need basal insulin. After that, a lot of times oral medications will continue to keep the blood sugar throughout the day at the needed level. If they don't, then you can add insulin, of course. We all are familiar with side effects of insulin. Hypoglycemia is a significant issue, and weight gain is another big issue that many patients begin to struggle with as they go on insulin and need to escalate insulin dose, particularly in type 2 diabetes, because of insulin resistance. Sometimes this dose escalation becomes kind of counterproductive as patients have more hypoglycemia, eat more, require more insulin, gain weight. They enter this vicious cycle, and then you really need to think about pulling back on insulin and kind of starting all over again. We've certainly had patients coming to us on a couple hundred units of insulin a day who are able to stop insulin with appropriate use of oral medications today.